Hello, my name is Haley Brown. I am in Adult Health 1, Section 2 in Professor Lloyd's class. Today I'm going to be performing an NG tube insertion and irrigation. Before I start this procedure, I'm going to implement standard protocols. I'm going to take a look at my doctor's orders and check it against my MAR to make sure that I have the right patient. The procedure that's going to be going on, in this case, it's going to be intermittent suction with an NG tube of a 14 French. It's going to be implemented today, and so I'm going to go ahead and grab all the equipment that I would need for this procedure. In this case, I'm going to grab my NG tube, which is the 14 French as ordered. I'm going to inspect the bag and make sure it's still intact. I'm going to need some lube for this procedure, a cup of water for Mr. Jones, a safety pin and rubber band to hold the NG tube in place, some tape, as well as my normal saline, my 60 ml syringe, and a pen light for inspection. Okay, so now that I have all my stuff together, I'm going to go ahead and enter the room. Hello, my name is Haley. I am going to be your student nurse today, and I'm going to perform a NG tube insertion on you. Could you please verify your name and date of birth for me? Okay, great. I'm going to check that against your wristband and my MAR. And that is correct. Mr. Jones, have you had this procedure done before? Okay, I'm going to walk you through the steps, so don't worry. I'm going to go ahead and make sure that my hands are washed, and I went ahead and applied my clean gloves. I'm going to go ahead and do an assessment on you really quick. I'm just going to go ahead and if you could just tilt your head for me, I'm going to take a look at your nares. I'm looking for patency to see if there's any deviations. I don't see any deviated septums. And I'm going to go ahead and make sure that you're in the right position, and you're in the high Fowler's position. That's what we're going to need for this procedure. I'm going to go ahead and if I could just occlude one nare for you, I want you to take a deep breath in and out through your nose, and then we're going to check this side as well. We're just trying to check, again, the patency to make sure that we're choosing the nare that's most open for this procedure. In this case, I've documented that it is going to be his right nare. I'm also going to take a look in his mouth to make sure I don't see anything that could be possible obstructions or anything, and his mouth is clear, which is good. So I have finished the assessment. I have my clean gloves on, and I go ahead and start this procedure. So before I do that, I'm going to make sure that I have a towel, because we're going to need this in a little bit to make sure that we don't create any messes. Again, I already have my equipment here. I'm going to go ahead and take out my NG tube, and I'm going to measure it against Mr. Jones, so it's specific to him. For measuring, you're going to start at his nare and go work your way around behind the ear, and you're going to land in the xiphoid process. And in this case, you're going to also want to document and measure the site where the NG tube should stop. And in this case, it's going to be 60. So I got my measurement of where we're going to be ending, and I went ahead and identified it with tape so I don't forget. Now that we know the length and where it's going to be, Mr. Jones, we're going to go ahead and prepare for the procedure. So again, I have a cup of water here for you. We're going to need to use that, and I'm going to go ahead and lubricate my NG tube for about 4 inches or so. I'm going to go ahead and bring it over to Mr. Jones. Okay, so I have you in that high Fowler's position, and for this insertion, we decided the right nare. And I'm going to go ahead and Mr. Jones, if you could please lift your head up some, and I'm going to go ahead and slowly insert this. I'm just going to go a little ways, and I'm going to check and see if I get any coiling in the back of the throat, and I don't see any. Mr. Jones, how are you doing? Okay, I'm going to go ahead and insert the tube a little bit more, and he's going to start most likely gagging and coughing a little bit, so I'm going to retract it back an inch or so. And I'm going to go ahead and give Mr. Jones some water so he can drink and kind of relax a little bit and rest. Now we're going to go ahead and continue inserting the NG tube. So I'm going to have him now bring his chin to his chest, and I'm going to go ahead and say, Mr. Jones, can you please take some swallows for me? Sips and swallows, and we're going to continue until we get to the tag that we have marked. So, Mr. Jones, can you speak to me? I want to make sure that he can speak so I know that I am in his stomach and not in his lungs or anything like that. So I'm going to go ahead and just double check again, make sure I don't see any coiling, and I don't. So now that we have the NG tube in and he is okay, he's speaking to me, we're going to go ahead and temporarily tape it to the side of his cheek. Now that we have that in there, we're going to go ahead and assess the placement of the tube to make sure I'm in the correct spot. So to do that, I'm going to go ahead and put on my stethoscope. And we're going to use the 60 ml syringe that I gathered earlier. I'm going to go ahead and attach it to my NG tube. I would also document the slack that I had left out from the spot where I had mentioned that we're going to stop all the way to here, just so we know. So if something happened to move, we would know where I had a baseline of where it started. Alright, so I'm going to go ahead and draw up and some aspirin. We're going to go to 30 mLs, and I note that there is green stomach fluid. It's not clear or white, so we know we're not in the lungs or anything. And I'm going to go ahead and inject that back into Mr. Jones, because anything I take out I want to put back in. But as I do so, I'm going to listen in the epigastric area for a swooshing sound. Okay, and I heard a swooshing sound, so that verifies my placement. But the only way that we can truly tell that it's in the right spot, hospital protocol, is to get an x-ray to make sure that it's in the proper placement. And again, you know, like we ended around the xiphoid process, so we should be in the stomach. Alright, now that we have made sure that we're in the right spot, I'm going to go ahead and anchor the spot to his nose. We're going to do so with this Y tape method, where you're going to just kind of crisscross it here. Okay. And then we would implement another tape across just to make sure it was secure. Something else that is depending on hospital protocol is to test the pH of the stomach contents. So whenever I had aspirated back, I would have just taken a little sample on and recorded it on the paper, and then again reinserting my gastric secretions back into the NG tube. So again, that's hospital protocol, it just depends. So now that we have placed this in and it is secure, we're actually going to attach it to Mr. Jones' gown. And the way we're going to do that to make it a little easier is I'm going to have him turn his head in the opposite direction for me. So we're going to have him turn this way just because I'm going to pin it to this side, and we want to make sure that he has slack and it doesn't get torn out or anything. So we're just going to use this rubber band and safety pin like we were showed before and attach it to Mr. Jones, his gown. Okay, so Mr. Jones, are you still doing okay? You're talking to me. Is everything as comfortable as it can be? I'm going to go ahead and hook this up to your suction, and it's going to be set on intermittent suctioning as my order states. So we're going to go ahead and hook that up there, and we can move your towel down a little bit now, and everything is properly placed. I would make sure that he's comfortable and everything, and as far as my documentation stage goes, I'm going to go ahead and document how my patient took the procedure, how well did he cooperate with it. Again, the numbers that I had mentioned where we had stopped, and then the slack that we had left. What type of catheter that we used, which again was the 14 French. The fact that we did intermittent suctioning. It was NG tube, 4 suctioning, not a feeding tube. And the other, the pH results that we did if we did that test. So also another thing that we would do is every 2 to 3 hours with the intermittent suctioning, we would be performing oral care. So I will be back in a couple hours to check on you, Mr. Jones, and see how you're doing. Here's your call light, and if there's anything else I can get you, just please let us know, okay? So finishing the NG tube insertion, I'm going to come back and do the irrigation of the NG tube. So I'm going to, again, my gloves are off, I come in, knock on the door. Hey, Mr. Jones, how are you doing? I'm going to go ahead and wash my hands. I'm going to go ahead and irrigate that NG tube now. To do so, I'm going to go ahead and take it off of your intermittent suctioning. And I'm just going to lay this back on your towel in case there's any mess. And I'm going to go ahead and put my stethoscope on. Grab my syringe again. And I'm going to attach it to my NG tube. I'm going to aspirate back 30 ml. And again, make sure to note and document the color and the characteristics of any of the fluids that you inject back out. Don't need to do the pH, that was from before. Now that I've checked to see the stomach contents, I'm going to go ahead and put it back in while listening to the epigastric area to make sure that I'm still in the right place and I hear that swooshing sound, which I do. Okay, now I'm going to go ahead and I'm just going to lay this on the tube. I'm going to go ahead and I have prepared some normal saline right here. I'm going to draw up 30 ml of the normal saline to irrigate the tube. I'm going to go ahead and listen again just to make sure we're in the right spot. Insert it back into my NG tube and listen. Okay, I hear the gurgling sound again. Now I'm going to go ahead and withdraw, and I'm gathering about 25 ml back. I'm going to make sure to document this later to know how much I put in versus how much I got out. And it is pretty clearish. You know, you need to note the color and clarity and everything. And aspirating was just to make sure that we cleared all the little holes at the end of the NG tube, make sure nothing was clogged or anything like that. So I'm going to go ahead and detach this. And again, I'll keep it here for documenting later. And I'm going to go ahead and hook you back up to suctioning, Mr. Jones. And make sure you're still comfortable and everything. If there's anything I can get you, please let me know. I'll go ahead and I would put you in your correct positioning and everything. And again, if there's anything I could do, please let me know. And that concludes. We got to do our documentation. Some of the things that I mentioned before. Again, how did our client take the procedure? The secretions that we got back, we put in 30 ml. How much did we get back? Document that, as well as our color and clarity of the stomach contents. The fact that we're back on the order, as we had said, and you know that there was no difficulty for the situation, that he did pretty good. So we'll also document that. So that concludes this video.